I'm Dr. Danny Lehnert, the owner and physical therapist at Eclipse Wellness in Sterling, Virginia, and I wanted to talk today about herniated discs. I wanted to talk a little bit about some misconceptions I see, some general advice I like to give patients, as well as some exercises that work really well when it comes to dealing with a herniated disc. Now, the number one piece of advice I would give someone with a herniated disc is to try to relax. There's a lot of fear around the idea of a disc herniating, nerve impingement, all that kind of stuff. Am I going to need surgery? Things like that. The biggest advice I can give is take a deep breath. It's going to be okay. You need to find someone, ideally a physical therapist you can work with who's seen a bunch of cases of herniated discs, but you will get better in all likelihood. So I want to talk through some things that can hopefully give you a little bit of sense of confidence and give you some ideas in your rehab journey when it comes to herniated discs. To help decrease your fear as it comes to herniated discs, I think it's good to share some information about discs and how they're really not the big scary boogeyman we make them out to be. So discs are actually a helpful part of your body. So our spine is a bunch of vertebrae that are stacked on top of each other. In between those vertebrae are intervertebral discs. That's what we talk about with the herniated disc. So the disc's main purpose is shock absorption. So if you're bending, twisting, things like that, the stress doesn't go on the bones. But they also help with general mobility, because if you imagine if you just had a bunch of bony spinal segments stacked on top of each other, you'd be very stiff. It'd be hard to move side to side, bend, things like that. The discs let that happen. An interesting fact is that as we get older, we actually lose height in our discs because we lose water content. So as we age, it becomes harder to bend, harder to move, stuff like that, because the back actually gets stiffer because there's less of a disc. Now, the good thing with that is the incidence of herniated discs is typically in the 30s, but kind of going into the 50s. But by the time you're 50, you're starting to lose some height in that disc. So it's actually harder to herniate because there's less of a disc to herniate. Now that tends to come with stiffness, loss of height, things like that, but at least we're not as worried about herniated discs. Now, another important factor when it comes to discs is that we've done a lot of studies on people, we're doing MRI, people who have no history of back pain. And you'd be amazed how many of them actually have herniated discs or degenerative discs or things like that. So in people as young as their 30s and their 20s, there's an over 30% incidence of asymptomatic herniated discs. What that means is you're 30 years old, you get selected for a study, they do an MRI of you, whoa, you have herniated discs. Well, I've never had back pain before. How does that make sense? As you get into folks in their 80s, that incidence goes up in the 90% range, because as we get older, discs are kind of like scars, it's gray hairs, these things build up in our body. Sometimes the body reacts to them, sometimes they don't. So the important thing to understand is if you have imaging and there is an MRI that shows a herniated disc and you have pain, then that may be causing the pain, but it also may not. And we may not need to wait for the herniated disc to heal all the way, because there are some people who have a history of herniated discs where it still shows on the MRI like it's acutely herniated, but they don't have pain anymore. So really it's important to understand that the imaging is not the end-all be-all when it comes to dealing with a disc or any sort of injury for that matter. Now, the last thing that's important is I see a lot of folks who, as soon as they get the diagnosis of herniated disc or they see that MRI, oh, the disc is poking out like this, they think they have to have surgery. That's not the case. Research shows that conservative care is the best treatment for herniated discs. Now, the Cleveland Clinic says it can take 4 to 6 weeks, which is on the low end, in my opinion, of how long it can take for herniated discs to heal conservatively, but it can take that long. So a lot of folks say, I've had pain for a week, I want to get the surgery. Now, that's your prerogative, you can do what you like, but I tend to advise patients, if they're able, wait longer, because the non-surgical outcomes are great. Now that might mean that there's an injection, medication, things like that. That's not all purely physical therapy, but a lot of it is physical therapy. There's an excellent success rate if you give it time, which can be sometimes several months, but time and energy into rest, physical therapy, exercises, sometimes injections, things like that, you can get good outcomes just as good as you would from a surgery. So those are some basic misconceptions I think it's important to understand when we're dealing with herniated discs. Now I want to talk about some lifestyle changes you can make that can help with dealing with herniated discs day to day. When it comes to dealing with a herniated disc, there are 2 main things to think about in your day-to-day activities. 1, movement is better. Our discs really don't like to be sedentary in any one position for a long time, whether that's sitting, standing, lying down, because what's happening is our body's creating inflammation when we have herniated discs. Now, inflammation is great because it helps our bodies heal. That's what brings the healing factors in the area. So if you bang into your knuckle or stub your toe or anything like that and it swells up, that's your body's healing response. Now, the issue becomes when there's swelling and then the swelling doesn't go anywhere, because what happens is when we have inflammation, our body then reabsorbs it into our lymphatic system. It gets separated, kind of takes the trash out, so to speak. So the inflammatory stuff goes in there to help heal, then it's helped heal. We need to get it out because we need to get new stuff in. But if you're sedentary, that swelling stays there, it gets stuck, it's like no one's picking up the trash, and it can actually delay the healing. So the best thing to do is movement. The other important thing about movement is that you want those muscles to stay as loose and mobile as possible surrounding the disc. You're gonna have tightening that area as your body goes into a protective kind of fight or flight response. You wanna down-regulate that. So what I suggest with people is, especially if you work at a sedentary job, set a timer for every 30 minutes on your phone. Get up and move around. That's gonna stop that stiffness, because if you're in any one position for a long time, if you're sitting at the desk for 2 hours and you try to get up, it's gonna hurt pretty badly. Now, sleeping, there's only so much you can do. You're gonna be ideally in one position for 8 hours so you can get some sleep. You're gonna be pretty stiff in the morning. So using a heating pad, things like that can be helpful. Some gentle movement to start the day. We'll go over some exercises in a little bit that you can maybe try when you first get out of bed in the morning. Now, the other piece of advice is extension. So typically with herniated discs, they prefer to be extended, so in an upright posture versus flexed, bent forward. Now, I have seen some that are the opposite, in which case you need to react based on what your body is doing. Now, if you're the typical presentation who doesn't like to bend forward and definitely doesn't like to twist, then standing is going to be better for you than sitting, because when we're sitting, we're tending to flex forward, compressing that area where the disc is, creating irritation. Standing, it's a little more extended, it's a better position to be in. Now, if you are sitting for a long time, I have a lot of patients who enjoy using a lumbar roll, so that can literally just be a little towel or a sheet or something rolled up behind you in the small of your back, at the back of your chair, because that's going to keep you in a little more upright posture. Extend your low back through there, taking a little bit of pressure off of the disc. You're also going to benefit. Some people like a stand to sit desk, something like that. A lot of that can just be that it's getting you to move and switch positions every 30 minutes, going for walks, things like that. But all these are viable strategies when we're dealing with the herniated disc and we're just trying to be comfortable. Now, when it comes to sleeping at night, typically extended positions are going to be better for you. So laying on your back is typically the best from what I see. Now, people might still like a pillow under their knees or something to take pressure off their back. Or laying on your stomach can be helpful in some cases if your body can handle that extension, or you may need to put a pillow under your stomach to make that happen. Now, laying on your side can be a little bit tricky because that puts you in that flex position we talked about, might not be the most comfortable. If you're a side sleeper and you can't do anything about it, try putting a pillow between your knees to at least avoid shifting and rotating, which can also irritate that disc. That all said, you're going to be in one position for a long time, ideally with sleeping. And so we kind of just have to do what's comfortable, and then we deal with it in the morning, because the sleep is important, because that's going to help with your healing, that's going to help with your recovery. So those are a couple simple ideas that you can use during day-to-day time. Now, you should be seeing a physical therapist if you're dealing with herniated disc, and they should have more suggestions just to make the day a little more bearable, make things a little bit more easy for you. The answer is not go lay in bed because you threw your back out. We don't do that anymore. The answer is movement, heat if you need to, things like that. Maybe you need medication from a physician. But having ideas like that, along with what your physical therapist says for general life modifications, can be the most beneficial. So now I want to talk about some specific exercises that I love for patients of mine who are dealing with herniated discs. There are many great exercises that can help with herniated disc, and I just want to highlight a few and give you an idea of my rationale of why I use them. So the first couple movements are ones you can easily perform on a table. We're not working against gravity, we're just working on mobility. This is if your disc is super flared up and irritated, or you're just lacking some general mobility in what you're trying to do. But it's best to start with unweighted movements to kind of get the back to relax and move a little bit better, and then gradually go into more weighted movements. So 2 exercises that I love, either on a physical therapy table, on the ground, in your bed at home, things like that. The first one is the prone press up. So all you're going to be doing is as if you're doing a push-up, hands to the sides here, and you're pushing to extend your back. So what you're thinking about is keeping your hips down. You're trying to stretch through your low back and let your low back relax when you're doing that. Let your arms do all the work, and we're stretching those muscles in our back, because as I mentioned, when we're dealing with herniated discs, they really like extension. So that extended position through there can be a great way to relax the back and get some movement in there. The next one I love is a pelvic tilt. So I start these lying down so people can feel them, but I'll gradually progress people to sitting, standing, a little bit more functional postures with a little bit more difficulty to really challenge your back. But a pelvic tilt, all we're thinking about is laying here, knees bent like we're gonna do a bridge. You're thinking about your low back coming off the table and onto the table, back and forth. Now you can start with big movements and gradually get a little bit more subtle in how we're moving. The key is we're trying to rock that pelvis back and forth to add some mobility in that area. A lot of patients that I see who are dealing with acute or chronic back pain, their back becomes stiff as a board, and research shows that. You don't want to move areas that are painful. So we try to relax by moving your pelvis so that you loosen up your mid-back and your low back and your pelvis, And that way there's a little bit more segmental movement and stretching through there. Those individual muscles in between the spinal segments get stretched instead of everything becoming stiff and locked down that limits your mobility later on. So these are a couple simple table exercises. Let me show you some standing exercises, a little bit more functional, especially if you start to feel better with a herniated disc. I had mentioned earlier in the video that flexion and rotation are the two movements that typically put the most stress on the disc. So a great way to introduce rotation is with an isometric exercise called a Pallof press. So isometric exercises, if you haven't seen my videos before, are exercises where the muscle's not changing in length. So imagine if I'm curling my bicep and I'm just pushing against something, I'm not actually moving the bicep. Now that's a good thing because I'm not creating stress in the muscle that's breaking down and building up tissue. So I'm getting some blood flow and some stimulation, but I'm not doing as much damage to the muscle. So it's a little bit easier to handle, especially early in the rehab process. So a Pallof press, I'm just gonna have something anchored here, and I'm gonna come out to the side, feet shoulder width apart, bend my knees, and then I'm just pressing in and out, trying not to let this rotate me. Now I'll do it to both directions. Now I'm using those little muscles in my back to stabilize me here. Those muscles that run right near that disc that are innervated by the same nerves, your multifidi are the main ones. And so what that's doing is that's giving a little bit of stimulus to hopefully relax those muscles and begin to start stability training through them. Because when you get back to lifting things, when you get back to moving, you want those muscles turned on, you want them activating, you want them firing on all cylinders. So this is a great way to wake them up. Now I love Pallof presses because you can scale them very easily. You can get a heavier band, you can go out further, you can do more repetitions. If it becomes easy here, you can go feet together, you can sag your feet, you can go on one foot, you can try to be going up and down with them. There's a million different ways to do it because I want my clients to have progressions of what they're working on so that they can challenge themselves. Because if you get to the point where a Pallof press is easy, the answer is not just keep doing that into infinity. Maybe we scale to a higher exercise, or maybe we keep doing this, we just change it up a little bit. So you have a little more control over the rehab process by trying to do different things that you like. So the next exercise that I love for patients who are dealing with herniated discs is a squat. So we can just start with body weight squats. We can once again do isometrics, a wall sit, but squats are very easy to scale because you control the range of motion. So if you're familiar with squatting at all, what a lot of people will say that's very controversial is the bottom of squat, there's what we call the butt wink. So that's where I'm squatting down and I get to a certain point where I don't have enough hip mobility and my lumbar spine is gonna flex down to let me get there. So I'm going down, 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 flex down at the bottom like that. Now that is putting stress through your lumbar spine. That can be a good stress if we're managing it appropriately. But if you can't handle it early on in the rehab process, you see what that limit is for you and you stop short. So you're just squatting through a range of motion that you can handle, or there's very little movement of the lumbar spine. Or you're putting a chair or a bench or something behind you that really limits you in what you're doing, or you're using lighter weight. Now, as you start to get stronger, as you start to get more mobile, we're going deeper into the squat, we're using heavier weights, we're putting weight on our back, we're changing, once again, all these variables that we can change, and it's a functional movement, it's a squat. We're getting our legs stronger. We're loading our lumbar spine through flexion, which is important. That's what we're scared of when we're herniating discs. And so it's a good way to introduce it. Now, another exercise that I love is a deadlift. So you can use dumbbells, barbells, whatever you prefer for a deadlift. It is the exercise that I guess the most pushback from people because they're the most scared of it. It's the best exercise when it comes to getting your back strong because we're strengthening our low back and our hip muscles and everything like that. There's nowhere for the low back to hide. So starting a deadlift, you can use light dumbbells if you're more comfortable, bending the knees a little bit, and we can start from the top and literally just go down as low as we're comfortable and come back up. As we get more comfortable, we can start doing greater range of motion. We can start using heavier weight, very easy to scale. As we get super duper comfortable, we might try Jefferson curl, which is I'm standing here, I'm thinking about rounding down from my head, rotating all the way down through here, stretching my low back, and then peeling back up, starting to introduce some mobility into the individual segments of the back. Because like I talked about earlier, the big issue with people with back pain is their back gets very stiff. So that is the downside of deadlifts, is you are teaching stiffness in the low back, which is a movement I'm trying to avoid with people. So sometimes we'll break out a Jefferson curl to try to really stretch that low back through some load, through some weight and everything. So those are some exercises I like to get started with in the weight room. I want to show you one more exercise and kind of talk through some more rationale of what I like to do with my clients with herniated discs. The last exercise that I love for folks dealing with a herniated disc is some sort of power exercise, whether that be jumping. I love medicine balls. If you have followed me at all and watched other videos, you know that I think that power is undertrained when it comes to athletes, but also general population folks, where if you're coming back from a herniated disc and you're feeling a lot better, we grab a medicine ball and try to throw it into the wall as hard as we can like that. We do overhand throws, we do all kinds of different things like that because One, that's going to reveal any issues, because if you're not able to really cut loose with that, then we're not done with rehab, because we're not fully back. Your muscles are still guarding a little bit. We want to put them in uncomfortable positions, see how they respond. It's also training you for functional things. So if you have to quickly turn, if you have to reach for something, things like that, you want to be so confident that you're not worried about how your back's going to respond if you have to quickly turn and grab something in your back seat or something starts to fall or whatever it is. That's the last step of rehab that's often missed, is you see those folks who, they come back, they get strong, they do their exercise and physical therapy, but they're never quite moving like they used to. There's still a little bit of stiffness in their back. They're still a little fearful. If you're throwing a 10-pound medicine ball as hard as you can into a wall, the fear must be gone, because you're throwing it as hard as you can. You're not thinking about it. You're not worrying about what your back's doing. You're just worrying about throwing that ball hard. That's where we want to get to in physical therapy. You're not worried about how much weight, how quickly it's moving. That is the ultimate goal. So that kind of summarizes my philosophy when it comes to exercises. Let me give a brief rundown on everything we talked about and just kind of wrap up the video. Well, thank you for making it this far into the video. I just want to give my final thoughts on herniated discs. Above all else, like I said, relax. If you have a herniated disc, chances are it will improve with conservative care. Now, it might take a while. It's easy for me to be the one here saying, don't worry, 4 or 6 weeks, couple months, don't worry about it. It can be incredibly painful. It can be incredibly scary. That's why it's important to find someone, ideally a physical therapist, who knows what they're doing, who's seen herniated discs before. I've seen hundreds of herniated discs in my time, having worked in a spine clinic and now at Eclipse Wellness. But it's still a difficult process even for me sometimes, let alone the person who's going through it, who it's the first time they've dealt with it. So find someone who can help you relax, who can give you that roadmap of this is what we're going to work on, because conservative care works. Don't be beholden to your MRI. You're going to get an MRI probably. You're going to be scared because it's going to show nerves being pushed on. That might have been there before. That might be there after. That might scar down. We don't really know. MRIs are just a snapshot. It's valuable information. It can help us as physical therapists, but is not the end all be all. I more so care about how you're moving and how you're feeling as an individual. Now, movement is the best thing you can do when it comes to herniated disc. Like I said, even if it's getting up and walking every 30 minutes, that's much better than anything else you're going to do. If it hurts to bend forward a ton, try to bend backward. If it hurts to rotate, try to do an isometric exercise like a Pallof press. If it really hurts to do anything, use heat, walk, move around, do things like that. But find things that you can do movement-wise that your body handles, because it's going to be better off in the long term the sooner you can start moving. Do not just lay in bed waiting for your back to heal. That's going to make it worse. The inflammation is going to accumulate. It's not going to have anywhere to go, and it's going to delay the healing process. Now, if you're in the Sterling, Virginia area, feel free to pop by Eclipse Wellness. I'd love to have you do an assessment, give you a roadmap, give you some ideas to work on, some exercise progressions like I said. If you're somewhere else, if you have any questions, please feel free to comment on this video, and I hope you can find a person who can help you in your journey when it comes to dealing with a herniated disc. Thanks for watching.